On November 4th, 2008, residents in the village of Holmen will have the opportunity to vote on two very important issues. The first and most obvious is the presidential election, a sacred and cherished right for an individual to make a personal choice. The second issue, and in my opinion even more sacred and personal, is a health care choice. Residents will be asked to support or oppose the practice of chemically altering the natural water supply in an attempt to prevent or reduce dental caries. My name is Dr. Michael Berkley, and I have been asked to make a presentation on behalf of the citizens who are opposed to community water fluoridation. We ask that you vote no to fluoridating the village of Holmen's water supply. Most people realize the importance of good dental hygiene and good dental habits. Choosing to brush and floss regularly, visiting your dentist, avoiding sweets and other negative nutritional habits are all excellent choices. I am thankful we live in a world that allows us to have choices. The principle of choice is the very backbone of our Constitution, and concepts such as freedom of religion and freedom of speech embellish this very concept of choice. Most people who oppose community water fluoridation believe that this practice violates their ability to make a choice. We believe individuals have a fundamental right to choose what enters our body. We believe that we should have the right to choose what fluids, foods, medications, and other nutrients enter our bodies. We believe that the lifestyle choices we make directly affect our personal health, success, and happiness, as well as the health, success, and happiness of our families. Fluoridating the public drinking water eliminates everyone's choice to drink pure, natural, non-medicated water. It eliminates the ability to make a personal health care choice. This is a guiding principle why we ask you to vote no to fluoridation. Most people who oppose community water fluoridation believe that this practice may adversely affect their health. They believe that adding the chemicals commonly used in artificially altering the natural fluoride levels in the public drinking water may cause adverse health conditions in the long term. One of the reasons we feel this way is because fluoridation chemicals are generally byproducts of the phosphate fertilizer industry. These chemicals may be toxic to the human body as they accumulate in the tissues over the long term. We believe that it is impossible to know the long-term cellular and genetic consequences of altering the natural water supply. This is another reason why we ask you to vote no to fluoridation. Most people who oppose community water fluoridation believe that this practice violates modern healthcare ethics as it relates to mass medication and informed consent. You may have noticed that over the last 15 years, many things have changed in healthcare. One of the most noticeable changes has been the practice of discussing potential side effects and dangers of prescription drugs with patients. Another example is discussing all available options and risks associated with recommended treatment plans or surgeries. This is called informed consent. And modern healthcare protocol requires this practice to ensure that each person fully understands the potential risks and options before making a healthcare decision. Communities who artificially fluoridate the public water supply completely violate modern informed consent practices. This is another reason we ask you to vote no to fluoridation. Another change you may have noticed is that prescription drugs are being tailored to the specific needs of each individual. Complex lab work, detailed case histories, balancing, and the rebalancing of multiple combinations of prescription medications are monitored to determine patient progress and therapeutic effectiveness. Gone are the days of one or two drugs for everybody with heart disease. Gone are the days of prescribing antibiotics for everyone who walks in the door with a head cold or ear infection. Drug-resistant bacteria, litigation, and the evolution of new ethical practices have forced changes in once commonly accepted standards. Imagine how easy it would have been for the medical profession to recommend adding low-grade amounts of antibiotics to our water supply to reduce or prevent infection. Imagine how easy it would be to recommend adding any number of chemicals to our water, air, or food to reduce or prevent arthritis, nearsightedness, memory loss, decreased strength and stamina. For every common malady, we could add a vitamin or mineral supplement to the water supply. But not once has any other healthcare discipline besides dentistry ever attempted to add a chemical to our water to reduce or prevent disease. Community water fluoridation is an archaic and unethical form of mass medication. The practice of community water fluoridation began in 1945 and has slowly grown to include about 65% of the nation's public water systems. The practice was started when America ranked in the top 5 of the healthiest countries in the world. Since the early 1950s, America has steadily dropped from the top 5 healthiest countries in the world to 26, according to World Health Organization's 2003 census. Many people believe that altering our food and water supplies with pesticides, preservatives, artificial ingredients, and chemicals such as fluoride are contributing factors to America's decline. We must always remember that our bodies are living organisms designed to live in balance with our internal and external environments. As such, our bodies have evolved over centuries without the exposure to the toxins and chemicals that we are now putting into our bodies. Health-conscious people and cultures today are trying to minimize the toxins and chemicals that they put into the environment and their bodies. Examples of these health-conscious trends are the increased popularity of organic farming and foods. Organic Valley and our local food co-op are excellent examples. Everywhere you go, people are drinking bottled water. Health-conscious companies are rejecting genetically modified foods. Most recently, the largest dairy producer, Dean Foods, said that they would not use cloned animals in any of their products, despite the safety claims by various government agencies. Cloning, genetic modification, artificial ingredients, preservatives, colorings and dyes, and chemicals, including fluoride, are being looked at with much greater scrutiny by health-conscious people. The majority of the healthiest countries in the world have banned, rejected, or stopped fluoridating their community water supplies for legal, health, or ethical reasons. Finally, some of you may be struggling with voting no to fluoridation. For many of you, voters and residents will only consider the claims of reduced dental caries when deciding to support or reject fluoridation. Let me say this again. For many of you, voters and residents will only consider the claims of reduced dental caries when deciding to support or reject fluoridation. I urge you to be cautious and not overlook the much larger picture. Carefully consider that you would be giving up a personal freedom, as well as taking that personal choice away from those who do not support fluoridation. Carefully consider the principles of mass medicating the water supply and potential ramifications. Ask yourself if it makes good common sense to artificially alter the water supply that nature has provided us since the beginning of mankind. For many, public smoking and secondhand smoke became a personal freedom and individual choice issue. By looking at the big picture, the freedom to choose what enters our bodies in public places was restored as communities across the country began to make it illegal to smoke in public places. Voting no to fluoridation is another chance to look at the big picture and ensure that you have the freedom to choose what enters your body.